So in today's class, we are going to discuss about therapeutic communication and nurse-patient relationship in mental health nursing. So you all know that communication means it is an exchange of ideas, facts and opinion between person to person. So here in therapeutic communication, it is an interpersonal interaction between the nurse and the patient, during which the nurse focuses on the patient's specific needs to promote an effective exchange of information. So therapeutic communication is an interpersonal interaction between nurse and the patient, where the nurse focuses on specific needs, specific needs to promote an exchange of information. Next, we'll see what is the importance of therapeutic nurse-patient relationship. So, all nurse need skills in therapeutic communication to apply the nursing process effectively and to meet the standards of care for the patient, because we will be working in bedside. We have to plan the nursing care plan so that we have to understand, we have to assess, we have to identify the needs of the patient, and we have to plan and implement the care. So, for providing standard of care for our patient, we have to know about therapeutic communication techniques and skills. And at the same time, what are the goals of therapeutic communication? Why we have to communicate to the patient therapeutically? It is to establish a therapeutic nurse-patient relationship. Next is, it is to identify the most important patient needs. And next, to assess the patient's perception of the problem, to facilitate patient's expression, and to implement the intervention. So, therapeutic communication is important to establish a relationship, to identify the needs, to assess the patient perceptions of problem, and facilitate expression of emotion and implement interventions accordingly. Okay, what are the characteristics of therapeutic communication that we are going to see next? Slide, we are going to see about the characteristics of therapeutic communication. So, patient should be the primary focus of interaction. In therapeutic communication, we are providing interventions, we are planning intervention for the patient. It is for providing standard care. So, the primary focus of interaction is patient. Next is use self-disclosure cautiously. That is, self-disclosing as should be used cautiously when you think that it has a therapeutic purpose. And we have to maintain patient confidentiality, assess patient's intellectual competence, determine the level of understanding. So, we should focus on the patient and we should use self-disclosure if it is needed, and we have to maintain confidentiality, and we have to assess the intellectual competence, because for communicating something, for giving some information, or for giving some suggestions to the patient for some problem solving, we have to understand whether the patient is able to understand what we are telling to the patient. Okay, so first we have to assess the patient's intellectual competence to determine the level of understanding. That is also a characteristic features of therapeutic communication. So, and we have to implement the interventions based on a theoretical base. We have studied in the principles of mental health nursing that, the patients, we have to rule out the problems objectively also. And we have to maintain a non-judgmental attitude. That is also in the principles of psychiatric nursing. We should be non-judgmental and non-punitive and give the patient to reinterpret his experience rationally and avoid social relationship with the patient. We have to communicate therapeutically, and at the same time we have to maintain a therapeutic relationship with the patient. Next, we are moving to the important topic, that is techniques of communication, techniques of therapeutic communication. Here we are having listening, broad opening, restating, clarification, reflection, humor, information, focusing, sharing perceptions, theme identification, silence and suggesting. So, we'll see one by one. So, first one is active listening. So, active listening, it is an active process of receiving information. It refers showing interest in what the patient have to say, acknowledging them and engaging them throughout the conversation. So already know active listening means listening to someone. Why we have to listen? In therapeutic communication, we have to listen to the patient to receive information. So information is essential in finding out the problems and providing standard care. So we have to show interest in what the patient have to say and accepting and acknowledging them and engaging throughout the conversation. So what are the examples? How we can show that we are showing interest to the patient? That is by maintaining eye-to-eye contact, nodding, gesturing, and some form of non-verbal communication also we can follow that so that the patient will be aware that he is being listened and he is being understood. Okay, so for example, at the same time, along with this eye-to-eye contact, nodding, gesturing, we can use some of the verbal cues. Oh, I see. Oh, I can understand your feelings. Okay, fine. Like that, we can tell some of the verbal cues. So even general leads such as what happened next can guide the conversation, or we can forward the conversation. Okay, so verbal cues we have to use, and at the same time some of the non-verbal communication techniques also we can follow to show the patient that we are actively listening to the patient. So what is the therapeutic value is? So while verbal and non-verbal cues communicate to the patient that the nurse interest and accept, that is we are interested in the patient and we have accepted the patient. Next is broad opening. So broad opening, it is a therapeutic communication. It is most effective when patient direct the flow of conversation and are at liberty to select topics for discussion. That means when we have to move towards a topic, that means we have to get some information from the patient. So we should start our conversation with broad opening. For example, what would you like to talk about, or what are you thinking about, can be a good way to allow the patient an opportunity to discuss what's on their mind. For example, a patient who is having post-traumatic stress disorder, okay, because of post-traumatic stress disorder. For example, we can take flood. Okay, all the family was being washed away, everybody has gone, only the patient is left. So because of that, the patient is having trauma. So we can ask patient, so would you like to talk about some traumatic incident that happened in your life? Okay, like that we can initiate the communication. So therapeutic value is indicates acceptance by the nurse and the value of the patient's initiative. Next is restating. So restating means, by seeing the word itself, restating means repeating the main thought expressed by the patient. So therapeutic value indicates that the nurse is listening and validates, reinforces, or call attention to something important that has been said. So sometimes the patient will tell, okay, for example, if you have taken that post-traumatic stress disorder case, the patient will be very much depressed because he has lost his family members. Maybe he may be telling his mother. So we can, okay, you are telling about your mother. What makes you to be so worried by thinking about your mother? Okay, that word we can ask, okay, what feelings you are having, what emotions you are having when you think about your mother. Okay, like that we can restate the word and we can get information from the patient. Next is clarification. So clarification means like active listening. Okay, to put the unclear ideas, thoughts of the patient into words and to enhance nurse's understanding. Okay, we may be having some unclear ideas. Okay, patient will be showing different emotions, but we are not getting an idea. So for example, I'm not sure what you mean. Could you tell me about that again? Because sometimes patient will be telling something about the family members or some of the friends, relatives, or some particular person. So we can ask in detail, could you tell me more about that again? Okay, so that it will be clarified, we will be getting better information. So it helps the nurse to understand the feelings, ideas, and perception of the patient, and it will be easy for us to correlate between the patient's actions and the like subjective and objective data to frame. It will be easy. Next is reflection. So reflection means patient often asks nurses for advice about what they should do to counter certain problems. So nurses can direct back the patient's ideas, feelings, questions, and content and ask them what they think they should do. So for example, you are feeling tense and anxious and it is related to a conversation you had with your husband last night, isn't it? So like that we can ask. For example, reflection means the patient will be eagerly waiting for some suggestions from our side. Okay, so before that we may be having, so before that we can ask the patient, what is your feeling? That means we can make the patient to think about, to reflect about certain thoughts. That is, it encourages the patient to come with solutions themselves, so to make self-decision. Okay, so in that way we can ask some questions. So what is your feelings? so is it related to some of the family issues, how you can solve, what you think, like that we can ask. Okay, so it validates the nurse's understanding of what the patient is saying and signifies empathy, interest and respect for the patient. Next is hope and humor. So hospital visits and stays are usually stressful for the patient. Okay, we all have experienced, might have experienced. Okay, it will be very much stressful for the patients. Okay, so sharing hope and that the current situation will improve and lightening of mood with humor can help the nurses to establish rapport quickly. That means what happens, we will be writing in our care plan, provided psychological support, all those things. Okay, it is very much essential for the patient to stay without stress. Anyhow, the hospital experience will be stressful, but from our side, we can give hope and a sense of humor and definitely make the patient to reduce anxiety. Okay, so for example, you can give a whole new meaning to the word nervous. Oh, understand how difficult this must be. We'll try to get the bottom of this and do everything we can to have you up and running again soon. Like some sentence we can make the patient to so that the patient will be having relief from his tension. So it can promote insight by making repressed material conscious, resolving paradoxes, tempering aggressions. Okay, some will be aggressive. Okay, especially in the psychiatric cases and revealing new options. And it is a socially accepted form of sublimation. These by using some of the humor words and by providing hope to the patient, definitely the patient will be free from anxiety and tension. Next is informing. So informing, we know that providing information. So the skill of information is giving. I think you need to know more about your medication. Definitely patient will be having many queries about medication, the duration of stay, maybe regarding the visit of doctor. Okay, this will be helpful in health teaching or patient education about relevant aspects of patients' well-being and self-care. And focusing means when something is okay, we are talking to some of the patient with depression or those, so that we may by talking to the patient we understood that the patient is someone is rude towards the patient, some family member is torturing or some things are going behind. Okay, so if the focus is on family, then we can focus more about the family relationship of the patient. Okay, so when something is important is being mentioned by the patient during the conversation, the nurse can focus the main thought by promoting the patient to take it further. For example, I think we should talk more about your relationship with your father, or this can allow the patient to discuss central issues and keep the communication. So it will be goal oriented. Okay, it will be very easy for us to formulate nursing process. Sharing perception means, you may be knowing that sharing perception, it is asking the patient to verify the nurse's understanding of what the patient is thinking or feeling. For example, you are smiling, but I sense that you are really very angry with me. Okay, so if we feel something that some perceptions, we can disclose it with the patient, and that time we will be able to understand more about the patient's feeling also. So it will convey the nurse understanding the patient as the potential for clearing up confusing communication. And theme identification, so it involves identifying the underlying issues or problems experienced by the patient during the nurse-patient relationship. For example, we can tell the patient, I noticed that you said you have been hurt or rejected by them, and do you think this is an underlying issue? So we may find that some issues, some key points or some issues, what happens in the patient that make the patient for some of the conditions or that create some problems or conflict with the patient. So we can identify that theme and then we can focus on that. So it will allows the nurse to promote exploration and understanding of important problem. Next therapeutic technique is silence. Silence means, you all know, that is lack of verbal communication. So here in therapeutic communication, sometimes we have to maintain silence. Okay, but because at times it is useful not to speak at all. Deliberate silence can give both nurses and the patient opportunity to think through and to gain insight. That is very important, to gain insight. It slows the pace of the interaction, encourages the patient to initiate conversation. Okay, to initiate some new topics or new conversation while enjoying the nurses support. Okay, so for example, sitting with the patient non-verbally communicating interest and involvement. And suggestion, That is the last techniques of therapeutic communication. So presentation of alternative ideas for patients consideration. Like we will be giving information, at the same time we can suggest some ideas for problem solving. How you to your a different way. When he raised that it is you with you, you could ask him if a special problem has occurred. Okay, this increase the patient's perceived notions or choices. So we can suggest some of the ideas or positive thoughts for the patient based on the understanding of the patient. Hope you have understood. These are some of the techniques of therapeutic communication, and it is important in exam point of view. Thank you for listening.